back to Benely Briefs, your go-to source for employee benefits and compliance expertise. I'm Heather.
And I'm Jamie. Today we're going to talk about the difference between HMO and PPO health insurance plans.
Now, before we get into specifics, let's start with the basics. HMO stands for Health Maintenance Organization, while PPO stands for Preferred Provider Organization. These are two of the most common types of health insurance plans offered by employers, and they both offer different levels of flexibility and affordability.
With an HMO plan, you typically have a primary care physician who manages your health care and refers you to specialists within the network. However, HMOs often require you to get referrals for specialized care, and they tend to have lower out-of-pocket costs.
On the other hand, PPO plans may provide more flexibility. You can choose any doctor or specialist you want without needing a referral. And while PPO plans usually have higher premiums and allow you to see out-of-network providers, it typically comes at a higher cost.
Another important aspect to consider is cost sharing. HMO plans often have fixed co-payments for visits and procedures, making it easier to predict your healthcare expenses. PPO plans, on the other hand, typically involve co-insurance, where you pay a percentage of the cost for services.
So, which one is better? It really depends on your individual needs and preferences. If you value the flexibility and the ability to see any doctor you want, a PPO plan might be a better choice for you. But if you're looking for a more affordable option, or if you have specific healthcare concerns that require multiple doctor visits a year, like treating a chronic illness, you may see the most benefit from an HMO plan.
Furthermore, with an HMO, you'll generally have lower out-of-pocket costs when you stay within the plan's network of providers. If you go out of network, the plan typically won't cover your visit unless it's an emergency. With a PPO, you'll have some coverage for out-of-network providers, but your out-of-pocket costs will be higher.
And that brings us to the end of today's episode. We hope this discussion has shed some light on the difference between HMO and PPO plans.
Thanks for joining us today, and be sure to join us for the next episode of Benely Briefs.